Tips to avoid sleep apnea. Sleep apnea is a potentially serious sleep disorder in which breathing repeatedly stops and starts. In this condition, since the breathing stops in intervals, the body cannot get enough oxygen and the person feels tired in the morning even after getting a good hour's sleep. If you snore loudly and feel tired even after a full night's sleep, you might have sleep apnea. The more common form is obstructive sleep apnea, which occurs when throat muscle relax. In this video, we will show you 10 tips to avoid sleep apnea. Let's start. Tip number 1. Have a healthy weight. Obesity can cause airway obstruction in the upper body and narrows the nasal passages. These obstructions can cause you to stop breathing suddenly or for lengths of time while sleeping. Having a healthy weight can reduce sleep apnea symptoms by clearing air passageways. However, regaining weight can return the condition, so it's good to maintain a healthy weight. Tip number 2. Daily exercise and yoga. Daily physical exercise can increase blood circulation and oxygen intake in the body. As I mentioned previously, sleep apnea causes a lack of oxygen in the body, so exercise is a great way to tackle the situation. Other than that, some breathing yoga poses also help in clearing the air passageway, good oxygen intake, and reduced oxygen obstruction during sleep. Tip number 3. Avoid dry air. Dry air can irritate the respiratory system. That's why people suffering from sleep apnea often wakes up with a dry mouth. To cope with the situation, try humidifiers. There are the devices that are used to add moisture to the air. Humidifiers can open your airways, decrease congestion, and encourage clearer breathing. If you are using a humidifier, clean it constantly to avoid any kind of molds and bacteria. Tip number 4. Positional therapy. Sleeping in a side position helps to reduce sleep apnea for the people who generates this condition because of sleeping on their back. There are devices out there that one can wear around their waist, which helps the person to sleep on their side. Tip number 5. Don't take sleeping pills, anti-anxiety medication, or sedatives before bed. Not taking sleeping pills or sedatives before bed helps to keep the throat from relaxing too much. Usually, sleeping pills and obstructive sleep apnea don't mix because sleeping pills tend to relax airway